Good afternoon, folks. Welcome to today's ACES 101 presentation on building an ACES-aware Kern County. Appreciate everyone's time to be on today's presentation and discussion to talk about our ACES-aware work here in Kern County. For folks that don't know what ACES is, it's adverse childhood experiences that anyone could be susceptible to. So I know folks are trickling in. We had about 30 to 35 folks RSVP, so there's about half of you here today. But we'll get started just to make sure that we abide by folks' time and the number of present and the presentation time that we have allotted for today. Thank you all for those that have made it today's presentation. Just so that you all know that this presentation is being recorded, so we can share it with partners that were not able to come here today. If you're attending remotely, please make sure to silence your microphone and mute yourself on Zoom. If you're joining us by phone, please make sure to silence your cell phone. If you have any issues with your mic via Zoom, you can always dial in with the code that was given to you when you registered. And, if folks can also just, if your name is something kind of wonky, please make sure to rename yourself so that we know who is here. And also, please feel free to add your pronouns so that we know how you'd like to be identified during today's presentation. Also, I would encourage folks to be on camera, to build a sense of community as we kind of go through this presentation. I know it's always hard to kind of be, remote and in kind of these virtual spaces, but it just creates a sense of accountability and opportunity for us to be in community with one another to support this work. So as we begin, I know there's a few of us, and if you could please put your name, organization in the chat so that we know who's here with us. And if at any point you have questions or things that come up, please feel free to put them through the chat, and then we'll move through them to really support any questions that come up for today. This is what our agenda looks like today. So we're doing welcomes, introductions. We'll do a short ACES activity. We'll learn about the ACES Aware Initiative. We'll discuss issues around toxic stress and ACES and how they show up here in Kern County. We'll discuss our ACES engagement calendar, and then we'll talk about some next steps to move us forward. But before we get started, I wanted to do an activity. So many of us, I don't know if you've done this already, one of the things that I wanted to do is for us to understand what ACES is. Give us context as we kind of move through this exercise. So in the chat, you will see a document that you can download, which is this, the ACES questionnaire for adults. I will attach it again, or you can look at the screen. And what I want folks to do is to look at these questions and by yourself, answer them yes or no. Once you kind of go through this list of questions, your ACE score is the total number of yes responses that you answer to these questions. We'll do a short anonymous survey to give us some context as we move forward. Take the next few minutes to look at these questions. There's about 10 questions here, number 1 to 10, and then go through them and see if you answer yes or no. And then we'll do a short activity with this. Again, the document can also be found in the chat, and you can download it yourself to have it on your desktop. So take the next few minutes to look through these questions and answer them yes or no. Okay, so I'll give folks 1 more minute to look at these questions, and then we'll go on to the activity. And so for folks that are ready and have already gone through these questions, the next activity we'll do on Slido. So if you want to go to slido.com and enter the code ACES21, we'll move from there. Great. So folks, if you can go to, again, slido.com and enter these questions, we'll move on to our next activity. So the first thing we'll do is, before you have your ACES score, is I want you all to share what are you hoping to do for today? Like, what are you hoping to learn? What are some of the things you want to walk away with today, so that we make sure that, you know, we cover some of these things as you come in. So that's the first activity. So first thing I see is a refresher and possibly new information or tools to share with staff around ACES. Additional things folks would like to walk away with for today. So get to join. You can join by your mobile, your computer. Go to slido.com and submit the code ACES21. So meet new folks who want to be trauma informed. You know, how can families recognize ACEs? So refresher on trauma. Information for clinical teams and staff who want to think about the intersection between ACEs with behavioral health and addiction issues. So just becoming more aware and informed around what's happening, you know, with this type of work. So understanding how the symptoms of adverse childhood experiences show up for folks. Okay. Any additional things? So how to help folks and individuals with ACEs. We'll talk a little bit about that today, around how to plug in with the existing resources. We'll talk about the symptoms of ACEs a little bit to show folks. Okay, I'm going to move on to the second question. So based on the survey that we took now around your ACEs score, right? I'm honestly share with us, you know, what was your ACE score based on the document that we shared? Okay, so we have about 10 folks who have done this. You know, 45 of us in here have stated 45% have an ACE score of 4 or higher, 27 an ACE score of 1, 18% about an ACE score of 2, and then 9% an ACE score of 3. Anyone else want to share? There's about 19 folks. Okay. And so the reason why I wanted to kind of do this exercise is for us to give us some context around how we're all carrying some kind of ACE score, whether it's 1, 3, 4, 5. We all, in some way or form, have experienced some kind of adverse childhood experiences that has impacted how we walk in this world, the relationships that we grew up. And so it's an important context to know who's here in the room and for us to put into context what we'll learn about here today. So let me stop sharing this. I'll close this poll. Great. Well, thank you so much for indulging me in that kind of quick activity so that we can talk about why ACE is here in Kern County. And so before we start, I just want to give folks some context around, what is ACEs? How did it begin? Why is it that Kern County is engaged in this work now? So the ACEs Aware Initiative is led by the Office of California Surgeon General and the Department of Healthcare Services to give Medi-Cal providers an opportunity to think about screening for ACEs in children and adults. In 2019, both Governor Gavin Newsom appointed Dr. Nadine Burke-Harris, a nationwide leader in pediatric medicine, to kind of lead this effort here across California. It was an issue to think about the adverse childhood experiences that communities undergo and figure out how can in a generation can we mitigate the toxic stress that we often see here for communities across geographies and boundaries. Dr. Nadine Burke-Harris, in partnership with Department of Healthcare Services and Governor Newsom, really took an opportunity to look at the science of ACEs and think about how can they bring together leading systems to think about how they reform and recognize and respond to these adverse childhood experiences that are happening across our community. As part of the initiative, the state awarded more than $30.8 million in grant funding to strengthen trauma-informed networks of care. So it's the groups of organizations, clinical settings, education institutions, behavioral health, a host of different partners working to support and address and mitigate toxic stress to come together to figure out how can we lift up some emerging practices to really address these issues within community. So Kern County was awarded a planning grant to support this effort. So to bring folks together, to build knowledge and resources around toxic stress, and to determine how can we best support our communities here in Kern County as we begin to address and shift the conditions that are holding this issue in place. And as Dr. Nadine Burke-Harris has said, ACEs and toxic stress are a public health crisis in California and throughout our nation. And we'll talk a little bit about more around why this is, but ACEs are not our destiny. It's opportunity for us to think about how we can shift the status quo and in a generation shift conditions that are present within our community. And so now what I'll share with you all is a short little video around ACEs that give us a sense of what ACEs are for us.
The story of your number is the story of your ACE history, a score used to measure the number of adverse childhood experiences that happened to you before the age of 18. ACEs fall into 3 categories: abuse, neglect, and household challenges, and are so common that 2/3 of us have at least one. A landmark study found the higher the number, the more likely one can experience negative health effects like heart disease, diabetes, depression, stroke, and asthma. The number is connected to an increased probability of lots of bad stuff. But you are not a number. The number is simply an entry point to your own personal story. Where it leads is up to you. ACEs are not your fault. They happen to us, but they don't need to define us. No person with a 2 is the same as another person with a 2. Each 7 is different from every other 7. Each of us is a unique story, and we each have the power to determine how our own story turns out. Explore the story of your number. Understand how it impacts the children in your life, and take control of where your story leads.
And so that video is just a recent campaign that the ACEs Aware Initiative has actually launched to support information sharing with folks across the community around what ACEs is, and that if you're having a high ACE score, that doesn't mean that you're destined for all these health conditions that might impact you. It's just an opportunity for us to think about how can we connect with one another to really support this work to mitigate the type of stress that folks might be experiencing, in their everyday life. And so as we begin to think about what ACEs is, ACEs are adverse childhood experiences that harm children's developmental brains and lead to changing how they respond to stress, and can damage both their immune systems and can have profound health impacts that show up for decades long. When we think about ACEs, we can also think about it, as a pair of ACEs, both the adverse childhood experiences that happen to us growing up, but also the adverse community environments that often are invisible to us, right? When we think about poverty, the lack of economic and social mobility, poor housing quality, community disruption because of violence, and a host of other issues that impact us on the kind of systemic issues that impact families. But then when we also think of ACEs, we can think about the adverse childhood experiences that we face when our families are facing with mental health. There's incarceration, domestic violence, depression, emotional and sexual abuse, when it comes to the environments that can continue to lead us to traumatic events, to experiences in our communities. Here in Kern County, what the data shows us is that about 18% of all households have experienced 4 or more ACEs. And so when we think about the individuals that we're working with our respective organizations or systems, how can we begin to think about how do we best support and connect these families to the resources that can help them thrive as we move towards addressing the ACEs here in Kern County. 47% have experienced between 1 or 3 ACEs. And again, we'll talk a bit about what this means when we think about the health outcomes for folks. One of the things that we see, as more and more folks are impacted by ACEs is really that it also leads to toxic stress. This map represents, life expectancy in Kern County based on, the stress levels that different communities across different zip codes might experience. And so as we think about, what this looks like for communities that you're serving or your own community or where you live, these are things that are impacting us every single day as we think about our own adverse experiences and our environments that help us thrive. One of the things that show up, is these types of trauma, right? It could be acute trauma, which often leads to a single event that lasts only for a limited time. It can lead to chronic trauma, which is the experience of multiple traumatic events over a long period of time, or it can lead to complex trauma, which is often used to describe a specific kind of traumatic event that impact children. Some of the things when we think about adverse childhood experiences, as the video showed, is around these 3 kind of categories around abuse, neglect, and household challenges, right? The higher the ACE score, the higher likelihood that you might be experiencing or susceptible to additional kind of increases in chronic diseases that might impact your health. So when we look at abuse, we have to think about the physical, emotional, and sexual abuse that folks might be experiencing, neglect, both physical and emotional, and then these household challenges, as we think about divorce, domestic violence that might happen, substance abuse, mental illness, or incarceration for folks. What the research shows us is that ACEs dramatically increase increase the risk in 9 out of the 10 leading causes of death in the US. So when we think about heart disease, cancer, accidents, Alzheimer's, diabetes, the higher your ACE scores, the more susceptible you are. If you have a high ACE score of 4 or higher, the odds and ratios associated with this are higher for you, yourself, and your family or your community. And so, as we think about the response to ACEs, this is an opportunity for not only ourselves to think about what our ACEs score, but how are we mitigating that toxic stress that we are encountering due to traumatic events or our everyday life. One of the things that ACEs does is it's cost, right? It's a high cost to the amount of resources and funding that we pay to support, the chronic diseases that we're fighting every single day in our communities. When it comes to cardiovascular disease, obesity, asthma, arthritis, COPD, depression. In the state of California, we spend about $112 billion to combat and address these issues within our communities. So as we think about addressing toxic stress and ACEs, we need to think about, how do we define toxic stress? What are the things that trigger us, right? Toxic stress is part of our every single life, right? There's positive stress, there's tolerable stress, and then there's toxic stress. Stress is the body's physiological and cognitive response to situations, events we perceive as threats or challenges. It's a normal and natural response to our every single day, but it depends, right? There's a fight or flight kind of mode that happens, right? Positive stress, right? An example is getting a vaccine, your first day of school, you feel nervous, there's some anxiety around that, but then it levels off. Tolerable stress is stressors that happen more often, but only last a limited time. So there's a high peak of stress, but then at the end, it continues to mitigate. So this is like the loss of the loved one or a broken bone that, it only lasts for a certain amount of time. And then finally, we have toxic stress, right? These are experiences that are strong, frequent, and are prolonged and are lasting a long time. And then these lead to longer term health outcomes that are impacting our well-being. Some examples include physical or emotional abuse or exposure to violence, right? And so you see, that there's this high level of stress and, the body kind of stays there and never levels off and goes down. Here's just another example around, how we respond to stress, right? Positive, tolerable stress, and the examples of how the stress activation really supports our health and well-being. So when we think about early life adversity, right? One of the things that we can think about, what are the protective factors and predispositions that lead us to vulnerability, right? We know that, toxic stress increases the physiological response. So, your endocrine system goes up, it affects the, neurons and connections that are made in your brain, which often leads to a reregulation of your immune system, which leads to epigenetic changes, right? Your DNA is changing because you're constantly exposed to this toxic stress. Your psychiatric and behavioral well-being changes. There's an inflammation of both your cardiovascular system, which often leads to associated health conditions which impact our health and well-being. Again, this is an example of the type of disparities and increase in risk for health conditions that you're amenable to, if you have an ACE score of 4 or higher. So when we took that survey at the beginning, over 40% of us here in this training, have had an ACE score of 4 or higher. So what does that mean for us as we're moving in this world and thinking about these chronic diseases and what it means to our health and well-being? And so I'll show another short video that kind of talks to us about a little bit about the toxic stress response in our body. So show that for a little bit.
Learning to deal with stress is an important part of healthy development. When experiencing
Sorry, technical difficulties.
Learning to deal with stress is an important part of healthy development. When experiencing stress, the stress response system is activated. The body and brain go on alert. There's an adrenaline rush, increased heart rate, and an increase in stress hormone levels. When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to act as a buffer against the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious, lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, the neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
The video shows, the impact of stress on our bodies and our health and well-being starts from a very early on. If we're experiencing these conditions, one of the things that we're hoping to do with ACEs Aware is for us to think about, like, what are the things that we're doing in our respective organizations, across our agencies, across our practices, to mitigate some of the toxic stress that we're experiencing every single day. I want to give this opportunity to folks. How do you all currently manage your own stress, right? Either if folks are feeling you can share it in the chat, or someone can unmute themselves to talk about this. Do you find yourself experiencing some of this toxic stress that I've talked about here in the video, both due to your environment or different things like that? Anyone willing to share? Everyone's side today. So I see practicing yoga to alleviate stress.
Sure.
Great. Oh, go ahead, Cynthia.
So I just shut the phone off and I go head up to my ranch that I live on, and I just walk and get out in the open and get some fresh air or ride a bike every day, exercise.
Great. So exercising, meditation, kind of just disconnecting from the things that are stressing.
Someplace peaceful. Yeah.
Okay.
Quiet.
Great. Other deep breathing and exercise I see in the chat from Mark. Anyone else want to share? Okay, that's great. So I think one of the things that we're hoping to do here in Kern County is to think about how can we collectively think about the toxic stress that our communities are facing. What are the things that we can do collectively to really address and mitigate and connect families to those resources that can help them thrive? I think one of the spaces where the ACEs Aware initiative really sees this work happening is in the spaces where families access, the resources and physicians where they see every single day. And so one of the goals of the ACEs Aware initiative, as we've embarked on it here in Kern County, is how can we get additional providers to think about the ACEs Aware framework as an opportunity to screen families, to screen adults, and connect them to the right services that can help them thrive, and mitigate some of those long-term health conditions that they're experiencing. And so one of the ways that we're envisioning this is by connecting, the kind of trauma-informed principles that we are the First Five Kern and other folks here across Kern County have been building over the last few years around how do we infuse trauma-informed care principles into our work. Here's some sampling around what some providers and the ACEs Aware Initiative are hoping support as we think about this work over the long haul, right? How can we establish the physical and emotional safety about our patients and staff, right? This is talking about a clinical setting, but this can also be applied to, different organizations that are providing care and resources for community. How do we build trust between both providers, community-based organizations, and patients? How do we recognize the symptoms of trauma exposure on physical and mental health? How do we ensure and provide a kind of patient-centered, evidence-based care to really support and buffer, some of the things that we're experiencing within our communities? And how do we collaborate with one another? How do we share resources? How do we bring in treatment processes and discussions that can help us reach mutual goals and really support one another as we embark on this journey, right? And then finally, how do we think about care that is sensitive to the patient's racial, ethnic, and cultural background and gender identity, right? We work with the farm worker communities, we work with, Spanish-speaking communities, we work with families who are diverse. And so as we think about what are the practices and resources that we're connecting these folks with, whether they're, from Central America, Latin America, from the indigenous community, whatever walk of life folks come in, how are we making sure, that we're being sensitive to their needs, that we're linguistically and culturally sensitive to the needs of the populations that we're serving and working with. One of the ways that we're envisioning this work is by supporting evidence-based buffering interventions that really help address and mitigate some of that toxic stress. Some of you all, in the chat and verbalize this, right? We're taking care of our mental health. We are creating supportive relationships with one another. We're getting quality sleep and accessing balanced, nutritious foods that can help us thrive and live longer. We're getting some physical activity and practicing mindfulness and supporting one another as we access nature and kind of disconnect from the things that are causing that stress and negativity within our lives. And so part of the work that has evolved here in Kern County has really been around creating this kind of network of care, which is basically a group of organizations that come from the health, education, human services professions, community-based organizations that are ready to support adults, children, and families by providing them with access to buffering and resources and supports to help and prevent and treat the harmful consequences of toxic stress. And so this looks like, food resources being accessed by food banks or food pantries. There's organizations that are providing social care referrals to help families, address their medical needs. It's connecting families to resources that include physical activity, childcare, and a number of other resources that help folks thrive in this environment. And so together over the last couple of months, and as we've been embarking this ACEs journey here in Kern County, our job has been to bring together some of these folks to let us know, like, what is it that, we can do collectively to really support, these resources in coordination of resources to communities across Kern County. Given the vast geography that is Kern County, we have our mountain communities, we have, Bakersfield City proper, we have unincorporated communities. So how can we work across these boundaries to really support and connect families that are in need, especially what's been happening with the pandemic and the lack of resources that they've been able to access during this kind of crisis. One of the opportunities that we've been able to capitalize here in Kern County as we think about this ACEs work, is the Kern Connected Community Network. So this is a network of organizations coming together to provide social care referrals through the platform called Unite Us. The platform now is 70 organizations strong and represent over 100 programs throughout Kern County that can make referrals within any of those kind of social buffering resources. If folks have not heard about the KCCN, we'll have an additional ACEs engagement session around this and to share out what we've been doing to really support and connect our families. One of the exciting things that's happening here in Kern County as we think about this ACEs work is getting medical providers to also be part of this network. And so that providers can actually, work with their patients and connect them with organizations that can help them mitigate some of this long-term toxic stress that they're experiencing as they're undergoing some of these traumatic events. A good opportunity, the Kern Connected Community Network also just launched a self-referral portal for community members who want to self-refer and get connected to services. This is in addition to the already 211 tools that exist here and the referrals that you all might be using to connect families. But this is also another opportunity, another tool in the toolbox to really think about how we connect families. And the exciting thing about this tool is that it's able to kind of share out some of these analytics and data so that we can see, like, if a referral was made, was it received, was it closed, what are the issues that happened with that referral, so that we can track and connect with families and respond in real time. Here's some data from from June of last year to December that really showcased the types of referrals that folks are looking to support as part of this kind of networking opportunity. We had medical expenses, emergency food, screenings and immunizations, clothing, household goods, and emergency housing as kind of the top 5 service types of social care referrals that were needed for folks that were accessing this network. And so this is just, the beginning conversation of, if you all are interested in some of this work, how can we plug you in? How can we create system synergy to make sure that we're all working and coming together to support engagement with this network that's evolving here in Kern County. And so as we think about ACEs and what this means for, providers and organizations, the ACEs initiative is specifically at this moment in time is targeting and trying to build a cadre of medical providers who are screening for ACEs. These are the specific groups right now that can bill for the ACEs screener for either children or adults. And so, the reimbursement, I believe, is $39 per ACEs screening within these clinical settings. So if you all know any nurses, pediatric screens pediatrics who are screening children, midwives, professional counselors, marriage and family therapists, physicians, physician assistants, Indian Health Services, psychologists, county hospitals, physicians groups, these folks can get plugged in and begin to screen for ACEs to help connect families to the resources that they need. Over the series of next weeks, we're midway through this grant, and over the next 4 months, what we're hoping to do is have some additional engagement sessions to help walk folks through around, what is ACEs, how can you get plugged in to this work. The next engagement session will be June 7th. It's basically learning how to become an ACEs certified provider here in Kern County, walking through around, the training that you can walk through to take it. If you're a physician, a test, and then go through the process to get reimbursed if you're doing these screenings within your clinic. This training is also available to nonprofit organizations and anyone who's interested in kind of learning the science around ACEs. You walk through a number of case studies and walks you through around how ACEs can show up in community settings. And so it is really an opportunity for us to start thinking about how do we use the same vocabulary, learn about this as another layer around the work that we're already doing in community, because we know this work is long-term. The state of California is making significant investments, and it's not going to go away anytime soon. And so as we move towards the different engagement points that we'll have another kind of engagement session June 10th to really dialogue and talk about, how is ACEs showing up and why is it important here in Kern County? What are ways that providers, you all as community stakeholders across Kern County are thinking about ACEs? What resources do we need, to think about as we infuse this type of work across our systems, across our communities to support them? What types of resources might be helpful to you all as we think about engagement and building a campaign around ACEs here in Kern County? And so really it is an opportunity to dialogue, be in conversation, and to engage one another. We'll have some additional engagement sessions. We'll have one specifically for providers around, what are some of the things that you all can do within your clinic to talk about, to test and go through that training. We're also hoping to have a symposium where we're bringing folks in from across Kern County to share out what's been happening here as we're moving some of the ACEs work. Some of the things that have come up from our partners is like, how can we infuse ACEs and these screenings into education settings, right? As we open up and move into a post-COVID recovery. You know, what are some of the opportunities that we can connect with our nursing folks and students who might be susceptible to learning and attesting and becoming ACEs aware, you know, when they're in their program to become nurses and the professionals they're gonna help serve us. And then, you know, either in July or August, dates are still to be determined. We're hoping to have a culminating conference event. We'll bring speakers, have trainings and workshops on trauma-informed care to really support and think about the work that we're envisioning over the long haul. And together, you know, some of the things that we want to do is like, what are the goals that we want to develop as a network of care to really help sustain and inform the work over the long haul? And this involves, you know, you all being critical stakeholders that are supporting community to be engaged, to support and lift up, you know, emerging strategies that you all are interested in lifting up. And so as we move forward, some of the goals that we're hoping to do as next steps is, you know, have your continued participation in ACEs engagement sessions. So sign up for future sessions, share these out with your network. You know, we need your support to make this work happen. There are monthly leadership meetings that you all can plug into and be engaged in to support this work over the long haul. If you want information around the Kern Community Connected Network, there's ways to get on that and to learn around some of the referral connections that are happening already within here in Kern County and to connect families. You know, and we want to connect with you. How can we be of service to you all and leverage this funding that we got through the ACEs to really support providers and partners who are interested in moving this work forward? And so really it is an opportunity for us to think about how we level up as a county to really support ACEs work, and to think about what are the resources and strategies that we can lift up to really work together to support this over the long haul. And then if you have any questions, contacts, you know, here's my contact information. Mark, who is working with Resilient Kern, is also co-lead on this work and is looking to support this over the long haul. So if there are any questions, opportunities, you know, this is our way to kind of provide an overview of what's been happening with ACEs, give you all kind of a lay of the land, and begin to build on additional engagement sessions that will happen over the course of the next few weeks or months. I know we have about 15 minutes left. I wanted to create space for us to engage in dialogue with one another. I know a lot of information was thrown at you around what ACEs is, how it's showing up in our work, opportunities, but wanted to create the space and opportunity to reflect and have a conversation with one another. So with that, I'll open it up. You know, if folks want to turn on their camera, we can kind of talk about anything that came up for you all as you all heard the presentation and information around ACEs Aware.
So Hector, this is Mark. There was one question if the PowerPoint's going to be available after.
Yeah, so folks that registered, the presentation will be sent out with the recording of today. If some of your staff were not able to come, we'll be able to share that back out with you all. And at some point, we'll be having this on a website that will also be accessible to folks. Are folks interested in, you know, what are some of the additional things folks would be interested in as we're formulating these ACEs engagement sessions that would be helpful to you all? I know at the beginning, additional resources around trauma-informed care, other things that came up for folks today. Don't be shy now.
Well, I think what I'll say something maybe to get you all to open up. The first time that I heard about ACEs was that aha moment And this was only a few years ago, in doing work around preventing premature births in Kern County. We had a collaborative we've been working with for many years and doing, I think, some great work coordinating care for moms who had had a premature baby. But we were still looking for what were the causes. And yeah, that's a very complicated issue. It's like an onion when you peel it all back. But at the root of a lot of issues that we experience with healthcare are ACEs. And the research that started back in the late 90s and has been supported through the Centers for Disease Control has demonstrated that there is a link between our early childhood experiences and our later health, and how that can be, as Hector said, transmitted from one generation to the next. And that's what ACEs Aware is trying to do, is cut the transmission in half within one generation. And we often think about the smoking crusade that started with another Surgeon General back in the 70s to cut the number of smoking related illnesses and deaths. And that has been dramatically cut in about a generation and a half. And that's the vision that ACEs Aware holds for not only Kern County, but for the country, if we can get that message across. Sometimes it's challenging because people naturally don't like to talk about what may have happened to them or what may have happened in their families. And so one of the things we did today was we encouraged you to be anonymous in that, but at the same time to understand that it's important to kind of understand maybe what our upbringing consisted of, and the fact that it's not a death sentence, that it's actually, to know is to take control of it and not to cast blame on an individual. To what, as one of our earlier speakers said in one of our early talks, was to rewrite that history. And so we're hoping that today and future events will allow folks to understand, to be able to rewrite their history and not carry something that wasn't their fault. And that's a message that we want to communicate to all families. And we want to learn from you, how do we get that message out to the broad-based community? There is an incentive of dollars for providers to charge for doing an ACE screen. But if we can get people informed and to better understand and communicate among family and friends, that cuts the time in cutting the dissemination of ACEs by, in a much quicker time, because we have informed community members who can be the best communicators as trusted individuals, as friends, as family, as teachers, as coaches, as any community leader. That message is listened to and better understood and trusted. So I hope that gives you some comfort in that, and maybe you can share some of your own thoughts about what you've learned today and what you've learned in the past.
Someone private messaged me, I think it would be a good idea to share this with elementary school teachers, maybe to help them understand where some of their students might be within their ACEs, thinking about TK, pre-K, those first kind of years during primary school as a suggestion, right? I think that's a fantastic idea. Thinking about how we get that information out to stakeholders who are engaging our children every single day, right? Who are engaging them. So, thank you for the person who messaged me that, but it's an opportunity for us to think creatively here in Kern County around how we, support this type of work with, it's not as additional work, but as an added layer of work to the work that we're already doing across our systems. Other thoughts? Want to create an inclusive space. If folks don't feel comfortable sharing verbally, please put it in the chat and we can use that as an opportunity to kind of create discussion. You're a quiet bunch today. We need to have some virtual coffee vouchers for the afternoon for these sessions so folks can be a little awake and alert. But again, a free invitation for folks to share out anything that resonated with you today, or things that you would want us to highlight.
I think that was a great, hi, this is Ameta. I think that was an awesome idea for the pre-K, and also to possibly even have a way to share with parents the importance of ACEs and how it affects their children would be great. But whoever had that idea about the pre-K and kindergarten, that's amazing. It's genius, and I like that. So thank you, whoever it was.
Thank you. Yeah, I know teachers have professional development opportunities, different things. How is it, can we bring that resource to them to make sure? Jackie, I see you're in media. You want to say something?
Yeah, Hector, thank you so much for the presentation. I think it was very helpful for me in sort of understanding the framing and the direction of the project. But something else is of interest to me, and I'm just wondering what yours and maybe Mark's thoughts are about. I'm still a little unclear about the process and how the workflow is going to look. And I understand that medical providers are going to be incentivized to do a screening, and they're going to be paid for that. But is there any sort of tracking on how many of those screenings actually result in a referral, and then what are the outcomes of those referrals? And whether I'm always, of course, very, very concerned about unintended consequences of working within the community in a very, very sensitive population. And so I'm always worried about protecting that population as much as possible while giving access or increasing access to resources. But I think maybe a future help would be to have a wonderful presentation like you gave today on maybe what the process and the workflows look like, and what the anticipated sort of routes are going to be from contact to receiving some of those resources that you showed that community has been able to access. So I don't know if that's too big of an ask, but I just thought, last time I had a big gap in my thinking about how this is working, and you filled in a lot of those gaps today. And again, I'm so new that maybe this is already well known to the rest of the group. So I apologize if I'm, sort of talking about something that everybody else knows. But anyway, your thoughts on that. Thank you.
Hector, I can take a crack at it. There actually, if you will, there are three intersections where your questions are very, very appropriate. Number one is whether it's a doctor or another healthcare provider seeing someone, let's just say someone, a patient, a client, a member of a managed care entity, and whether or not they ask about ACEs, or they ask about their history, or they ask them just to tell me your story. That's one intersection. Number two is if they decide to bill for it, that is actually billed to the state, to Medi-Cal. I do not believe that there's any score attached to it. It's just the fact that they're attesting to, just like any bill that they submit, and there's a code that's used for Medi-Cal for that purpose. And then the third intersection is, do they, and this is where it really comes down, do they choose to make a referral based on the interaction that they've had with the patient? And that is being tracked in the Kern Connected Community Network. Currently, there's no score that's attached to it. There's some discussion about wanting a score, because then first of all, it states that the patient has given permission to share that their need and have a referral made. So permission has to be granted in order for a referral to be made. Once they give the permission, is it valid to ask, can the actual score be put in without all the detail, a de-identified score? Because then the other members of the network are in a position to better help that individual. Now, that doesn't answer your question and concerns that maybe too much information is being shared, or it opens them up to other conversations. So I think ultimately it's a really good question that you're asking, and we need to address that with the network. And actually, you can participate in that Kern Connected Community Network conversation if you like, because they meet on a monthly basis and spotlight some of their services. And there is one coming up, I believe it's on Thursday, the 27th, if I'm right about that. Yeah. And we can share that information with all of you to say, do you want to participate in that? And you can ask your own questions. Does that help?
Jack,
Okay.
and I also put a link in the chat around some of the kind of workflow processes that ACEs Aware Initiative as a whole is kind of thinking about, but those are some suggestions. I think one of the things that we're learning here in Kern is like every population is very unique and has to them. And so one of the things that we're also working on here in Kern County is a pilot to think about how those workflows actually come to be for some of our providers. And they could look differently, whether you're a managed care entity, you're a local clinic like Omni Family Care, or you're working with different populations. And so I think that's a lot of the work and investment that ACES is doing into communities. Like, are there pilots that could be created, be lifted up to lift up those emerging practices that are happening in community? And so I think that's the opportunity here in Kern too. How can we be creative? How can we partner and lift up some of those best practices to really help support our own learning, our clinical partner learnings, to be trauma informed and to really support communities in a culturally relevant linguistic way that really helps support our communities, right? And a clear example I can give you, literacy issues is a big thing that one of our providers has encountered, right? Just even answering the questionnaire that I gave you all today, could we make that, into a comic or something more accessible that's relevant to folks? And so those are the conversations that we're lifting up to the state, as we're working towards something bigger, systemic, to really support this over a generation in California. So I know we're coming up on time. Any last thoughts from folks before we leave? I'll follow up to this will be the link to the presentation today, the PowerPoint, and then a link to our engagement calendar for next sessions if folks are interested in connecting with those.
And we would encourage you to share with others that these sessions are taking place, and also any recommendations for topics that you'd like to cover. So please help us. We want that. And there was in the chat, Virginia stated, we do not bill Medi-Cal, but I would be interested in to do the ACEs to learn how to do that. So appreciate that. Thank you all.
Great. Thanks, everyone. Appreciate everyone's time and energy during today's conversation.